Yeah. So last year when we talked, you told me that prescription drugs for sleep don't actually, they don't give you a healthy sleep. They just interrupt whatever pattern you're in, but that doesn't mean to say they make you, a healthy, refreshed, waker-upper, so to speak.
So I think there is always a time and a place for sleep medication during acute conditions. But right now, as a field, it's not recommended for long-term use, sleeping pills, for the reasons that we discussed in our previous interview. There is an alternative form of therapy that's just as effective. It's called cognitive behavioral therapy for insomnia, or CBT-I. And people can explore this. It's got different availability in different countries. That's a far better tool in terms of a non-pharmacological approach for improving the quantity and the quality of your sleep. And better still, when you stop working with that sort of therapist or that clinician, and it takes usually about 4 or 5 weeks, you continue your good sleep for years into the future. Whereas with those drugs, once you stop them, not only do you go back to the bad sleep that you were having, but typically you go back to having even worse sleep. It's called rebound insomnia when you come off those sleeping medications. So I think there is a time and a place, and you can speak to your doctor, but really try to seek out cognitive behavioral therapy. And there's lots of digital online platforms right now. One that I'm familiar with and involved with is called Shuni, SHUNI. And there are other programs where you can go online and you can get these therapies available to you in your home, wherever you are in the world.
Beyond those therapies, are there any quick tips that you would advise for people trying to have quality and quantity of sleep?
There are. I think the first 2 tips are regularity. Try to go to bed at the same time and wake up at the same time. Even if that's shifted during COVID, now it's shifted, keep it there. Your body responds to regularity for sleep, and it will improve the quantity and the quality of sleep. The second is alcohol and caffeine. Try to abstain from caffeine after 2 p.m. If you can do it after midday is even better. And then be mindful of your alcohol in the evening. Many people will turn to alcohol as the first sort of non-prescription sleep aid. And alcohol is not a sleep aid. It's remarkably bad for your sleep. It sedates you, it doesn't put you to sleep, it will fragment your sleep, and it will block your dream sleep, which we know is critical for a variety of mental health functional benefits. I think the third and last thing I would say during this era is, if you're in bed and you're struggling and sleep is just not coming to you, either you're falling asleep or you've woken up and you can't get back to sleep, then just take a break. It's okay to know that tonight is not my night, because sleep is a little bit like trying to remember someone's name. The harder you try, the further you push it away from you. And so the recommendation is, if you're struggling, get out of bed, do something relaxing, read a book, do meditation, listen to a podcast, and only return to bed when you're sleepy. And the analogy here would be, you'd never sit at a dinner table waiting to get hungry. So why would you lie in bed waiting to get sleepy? And the answer is you shouldn't. Just take a break, relax, know that having a bad night of sleep, or even a couple, is not the worst thing in the world. It's okay. You will get better sleep.
All right, that is good advice. Thank you, Matthew Walker. Now, as we continue